76ers star Joel Embiid is set to undergo a procedure on his left knee. The procedure will reportedly repair a torn left meniscus, which Embiid suffered during Tuesday's loss to the Warriors. There is currently no timetable for the reigning MVP's return, but he's expected to miss an extended period of time. As a result of the surgery, Embiid will not play in a minimum of 65 games this season, rendering him ineligible for postseason awards and all NBA teams. We now welcome in CBS Sports injury analyst Marty Jaramillo as we dive into the details of Joel Embiid's injury. Marty, it's been labeled that Embiid is expected to miss an extended period of time, but what does this timeline specifically kind of look like, especially if Sixers fans can maybe hope to get him for the postseason?
Well, first off, we have to give a shout out to everybody involved with the decision, because not only were they mindful of the seriousness of the decision, but also thoughtful of Joel's long-term health. Now, here's the situation. He was diagnosed with a flap tear of the lateral meniscus, which is on the outside. What are the meniscus? These two C-shaped discs that sit on top of the tibia. They spread out forces from sports. They are involved with shock absorption, and because they cup the femur, they're also involved with stability. Now, that flap tear is the most painful type of tears. This is why we don't have an exact timeline yet. The decision was to have surgery, to have a procedure, and I knew that was likely because it's very difficult to have to play through a flap tear type of tear. The reason why there's no timetable is they're going to go in first arthroscopically and make a decision. How is that decision made and what variables? Well, there's two types of tears. A tear that's towards the inside of the knee where there's poor blood supply, and all they can do is trim it away and clean it out and smooth out the edges. And that's about a 4 to 6 week recovery for what's known as a traditional meniscectomy, a partial clean out of that tear that has poor blood supply, clean it out and smooth it out. But once they're inside the knee, looking at with the arthroscope, if there's any chance that the tear is more towards the outside of the knee, where there's good blood supply, they are going to repair that meniscus, and that's a 3 to 4 month procedure. Why is that a good thing, even though maybe bad news for Sixers fans? Is because in terms of long-term health, keeping most of the meniscus intact provides them long-term health of that knee. And he's predisposed. He already had a lateral meniscus tear 2 years ago in the playoffs, has a second one now. So biomechanically, he actually is probably predisposed. That's why it's still a gray area. The decision was made to have surgery, and once they are inside, they decide if it's a traditional meniscectomy, because there's no chance of repair, or a repair, which is 3 to 4 months, but you'll have a great long-term outcome, and 4 to 6 weeks if it's just a meniscectomy.
Okay, you talk about the different types, and I want to talk a little bit of a big picture here, Marty. A surgery of this nature, and considering both whether it's on the inside and on the outside as you described, how will either affect Embiid's long-term play? Sure.
A meniscectomy, he'll be back to normal within 4 to 6 weeks. It's a very straightforward procedure, 45 minutes at best. They clean out the torn edges, smooth it out, and they start rehab the same day. No issues there. Is there a chance that taking out some of the meniscus can lead to long-term arthritis and decrease his career? Yes, the chance is always there, but there's no, let's say, A plus B equals C. There is a chance, depending on his health, maybe losing some weight, make sure he has great shock absorption, types of performance training to maximize that endurance over a long period of time. Now, but with terms of the repair, that's the best case scenario, because he keeps his meniscus completely intact, which leads to just a total health of that knee joint.
Okay, Marty, Embiid is among some of those superstars that are set to represent Team USA at the 2024 Olympics in Paris later this summer. But coming off of this injury and the surgery and the hopes that he's back for the postseason, would you advise him to participate, or would you probably err on the side of caution and probably tell him to sit this out?
I would, if I was advising him, I would err on the side of caution because there's no gain from that. There's nothing to gain from playing, in terms of representing his country in the Olympics. That said, there is no bad news here. Short term, he'll play in 4 to 6 weeks. Long term, yes, he'll be out most of the rest of the season, but available for the playoffs. But he keeps that knee as healthy as he can for the long-term health of his career.
It'll certainly be something that we will be watching over the next few weeks. I'm sure Sixers fans hoping to get their all-star back in the lineup by the postseason, but we'll have some weeks to wait until then. Marty, we appreciate the insight as always. Thank you so much.
Thank you.